Hip dysplasia is a common inherited malformation in dogs. It can be quite debilitating, and symptoms will often present themselves when a dog is still young and physically immature. Charles, what ages are you seeing dogs present themselves here for hip dysplasia?
So hip dysplasia is actually a biphasic disease. So we see them really early at kind of 6 to 9 months of age, and then if they haven't been treated early, they can present at 2 to 3 years of age with evidence of arthritis. Early on, what we see is just clinical signs of the looseness of the hip, where the hip is actually popping out of the joint. And with Henry's case specifically, Mary could feel the hip popping or clunking in and out of the joint as he was lying down. Clinical signs that we see typically with that would be reluctance to exercise. Sometimes in the middle of a walk, halfway through the park, they'll lay down and they won't want to go any further. Sometimes owners even have to pick them up and carry them home. The other thing that we see, interestingly, is a bunny hopping gait, which literally looks like a bunny hopping through the meadow with both legs working in unison. If you get it early on, particularly when they're less than a year of age, you can actually do some things to prevent them from developing full-on hip dysplasia. Things including as little as just weight loss, exercise modification, maybe some cartilage protective medications, all the way up to surgery. And surgery is actually very effective if it's done early enough to prevent arthritis from ever forming. Henry was actually a bilateral disease. This X-ray happens to show that one hip is more dislocated than the other. We can see here that there's a much wider joint space on this side than there is on the other, and that's because the ball is actually popping out of the socket, and that's what's causing the clunking when Henry sits down. What we see later on is that you actually start developing a lot of arthritis, and you have extra bone formation, and the joint capsule is really thickened and stuff, and they can actually get to the point that you have bone-on-bone grinding because the cartilage is completely worn away.
That sounds nasty, Henry, doesn't it, hey? So with Henry, his mum was really good at bringing him to you early, and you were able to get onto it quite quickly.
Yeah. So he was young enough that he hadn't developed any arthritis in the joint at all. He was only about 9 months of age when he got to us, and so we were able to do a procedure called a triple pelvic osteotomy. What we do with the surgery is we make a cut here, here, and here, and we're going to roll the cup over so that it covers the socket more effectively.
So on this model?
Yeah, so this is looking from his belly side here, so we're making a cut here, here, and here, and we're going to rotate it around, and then we put a plate in which is pre-configured, and when we put that in, what it's going to do is it's going to force that cup around and keep it in that position.
And you've got a post-operative shot there, a CT?
Do. Yeah, so it's a CT scan that was done, and this shows the plate in place with the screws going through the bone, and we can see the step that we've created there and rotated that socket around.
So that's a zoomed in shot of that
exactly
particular
the spot
area.
right here.
We know with Henry here that he did have pet insurance, so it would have significantly helped his owner with the costs.
Yeah.
What are we looking at for this surgery?
Our cost for bilateral triple pelvic osteotomy, so both sides being done at the same time, is about $8,000, including pre-op x-rays, post-op x-rays, pain medication to go home and that kind of thing. And then that doesn't even count physiotherapy. That's a really good idea to do later on. Sometimes owners have to take time off work. You might have to do long-term medication. Sometimes they put them on long-term cartilage protectant medications that might last for a lifetime. And so certainly having that luxury or the benefit of having the pet insurance from the start is really helpful.
So how's Henry doing now?
He's great. Boundless energy, he can exercise without any limitations, and he seems to be doing really well.
He looks like he's walking fantastically.
Yeah.
Well done, Charles.
Thank you. I'd love to take credit for it, but actually Henry and his mum did most of the work.
All right, well, it's a shared process, isn't it? And if you want to follow Henry's recovery, check out his Instagram page at Old English Henry. If you'd like to know more about pet insurance for your dog, have a look at the HIF website. What do you think, Henry? Hey? Good boy.